Konnichiwa, welcome back. Thank you so much for tuning in. Dr. Brace is here. I apologize for my voice today. I don't know what's going on. I'm not sick, but I have a weird voice today. So maybe I'm like in that Friends episodes when Phoebe gets sick and she has the weird voice and she thinks her singing voice is so much better. So she's trying to stay sick.
Thank you, my babies.
Who knows? Maybe I sound better this way. Today, we are going to talk about how can the orthodontist office tell if you are not brushing your teeth enough. The first way that we can tell, and the easiest way, is if your breath is really stinky. Actually, everyone wears a mask. It's required by law. And if I have this on and I can smell your breath through my mask, that's bad. That's really bad. That means you're not brushing enough. So that's the first way. Number two is plaque and tartar. So plaque, it's what builds up on your teeth. It's bacteria where if you're not brushing your teeth enough and you're not flossing enough, then you're going to get this kind of film on your teeth that's actually bacteria. It kind of looks like food. So a lot of the times when patients come in and I tell them, I show them in the mirror, look, you have all this plaque on your teeth. They say, no, that's food. Like, listen, that's not food. That's bacteria that are living on your teeth. The best way it was described to me is when I was in dental school, Dr. Carl Kingsley, who teaches at UNLV Dental Medicine, shout out to Carl Kingsley. The way he described it is these bacteria, if you don't brush them off your teeth, they live on your teeth. And just like you, when you eat food, what you have to do is you digest that food and then in the end, you poop, right? Well, these bacteria that live on their teeth, they do the same thing with the food that you eat. So you're eating food, they're getting that same food, they're digesting that food. And then what they do, the byproduct is they poop on your teeth. And what that poop is very acidic. And that acid is going to start to chew holes in your teeth or cause cavities in your teeth. And that's how you get cavities. So if that doesn't gross you out and make you want to brush your teeth more, I don't know what will. But again, Dr. Kingsley taught us that in dental school, that it's a byproduct of bacteria. It's their waste product that causes cavities and stains on your teeth. Tartar, that's another one. So what tartar is it's plaque that has been on your teeth. And basically in our saliva, there's calcium. And so over time, that plaque gets calcified and it becomes what's called tartar, or the proper dental term is calculus. Now, calculus is something that you unfortunately cannot get off with a toothbrush because it's so hard now, you have to scale it off. And that's why you go to the dentist every 6 months for your cleanings. And so with your braces or Invisalign, it's so important that you still go to do those 6 months cleanings because it's the hygienist that's going to go ahead and get that, what's called tartar or calculus off your teeth. Usually the area where you're going to see calculus is right behind the bottom teeth, on the inside of the teeth. And the reason for that, like on the tongue side of the teeth, the reason for that is we have a lot of salivary glands right under our tongue. And so there's more saliva that hits those bottom teeth. And so if you get plaque on those teeth, that calcifies relatively quickly. So those are the two things that we're going to look for at your appointments: plaque, tartar, are those on the teeth. And then the final thing is puffy gums, right? So that's called gingivitis. Basically what gingivitis is, it's an infection of your gums. And so that means there's that little plaque and bacteria that we talked about. Now is it just on the teeth, but it's gone and it's set up shop under your gums. And so your body's trying to help eliminate that plaque. And so it's puffing those gums up. When you brush the gums that have gingivitis, they're going to bleed. And that's a sign that you're just not taking care of your teeth and your gums and brushing enough. So those are the main three ways that we can tell if you're brushing enough. When you come into my office, every time you come in, you get a score. You get a hygiene score. And if your hygiene score is good, then we leave you alone. But if it's not so good, then we always try to correct you because it's really important that we take care of those teeth during the time you're in treatment. If those bacteria are there too long, when we go and we take your braces off, you're going to have the area around the braces is going to be decalcified and there's going to be permanent stains on your teeth. They're white, they don't look good. And if you don't do a good job, even worse, worst case scenario is those decalcified lesions have now progressed further and they're now cavities. So the last thing that I want to do for my patients is give them perfectly straight teeth with holes in them. But that part comes up to you, right? If you're not brushing and taking care of them well enough, then that's going to be a byproduct of the braces. So that's why it's incredibly important that you keep that plaque off the teeth around the braces. Now, as far as gum disease goes, gum disease is your first sign that there's problems with your gums and with your gingival health. And again, what that's going to look like is the gums will be puffy, they'll be swollen, and when you brush your teeth, those gums are going to bleed. Now, the thing about gum disease is it's reversible, meaning the effects of it aren't permanent. Now, if that gum disease progresses to something called periodontal disease, that's very bad. And the reason why that's bad is now it's not just affecting the gums, but that infection has now spread to the bone that supports the teeth. And so what happens is with periodontal disease, the bone will start to recede. So you've got a tooth that's covered with bone, right? If that bone starts to recede, guess what? These teeth aren't as stable and eventually they get loose. And then if it gets worse and worse, they fall out. So your goal, if you have gum disease, is going to be to eliminate that gum disease before it progresses to periodontal disease, because periodontal disease, unfortunately, is irreversible. The results or the effects of periodontal disease, that's permanent. That's permanent. That doesn't go away. You can't get that back unless you do some sort of graft with a periodontist. So those are things we want to avoid. So that's why it's so critical, so important that we take care of our teeth, we take care of our braces. We recommend that you brush your teeth with braces 4 to 5 times a day, 2 minutes every time, and that's going to ensure that these kind of side effects of not having good oral hygiene during braces aren't going to affect you and be a part of your permanent smile. Now, it's equally important to keep the teeth clean with Invisalign. With Invisalign, it's a little bit different. The problem areas, it's going to be around your attachments. And then the other spots you want to make sure you focus on with Invisalign is right along the gum line, because that's where those trays rest. And so if plaque is going to accumulate with Invisalign, it's usually along the gums where the tray stops. My philosophy with Invisalign is, I tell patients, the only tray that goes on the teeth with Invisalign is a clean tray. You never put a clean tray on dirty teeth, and you never put a dirty tray on clean teeth. You need both of those surfaces to be clean, because with Invisalign, that tray sits on the tooth tight and flush. So if there's bacteria there and then you go in and you add your Invisalign to it, guess what? That bacteria is trapped there. There's nowhere for that bacteria to go. So it's just going to be there for the entire day. And so again, that's why it's super critical with Invisalign. You keep everything clean. Only clean trays go on clean teeth, and that should be the general rule. If you're at school, you're finished eating, your Invisalign needs to go back in, you don't have time to brush, the best thing to do is get water, swish really vigorously for about 20 to 30 seconds, spit it out, trays can go in. And then when you get home, you can brush and clean everything up. But at the very least, you want to at least rinse really, really well with water before you put your trays back on. Only other tip I'm going to give in terms of brushing, flossing, keeping your teeth clean. I think we hit the points of why it's important. And that doesn't go just while you're in braces, but that's for life in general. You really want to make sure you're taking care of those things, because it can lead to really, really serious, significant, severe problems. But when it comes to braces, the area where people miss the most is between the braces and the gums. And that's because when you go and you brush your teeth, the brace is now in the way. So the spot that you're frequently missing is right along the gum line between where the brace sits and where the gum starts. And so you want to make sure you go back, spend some time right along that area, brush around the brackets, make sure those areas are all clean. And then a water pick certainly helps. I think flossing is the best thing. But if you're not going to take the time to work that floss around the wire, at the very least, water pick every day, and that'll certainly help as far as keeping the gums and everything healthy. So that's how we can tell if you're taking care of your teeth and keeping them clean. You can't hide anything from the dentist, unfortunately. I have patients come in sometimes and it's like, you had eggs for breakfast, because they're eggs all caked in their teeth, or you had toast for breakfast, because there's bread and eggs, they kind of stay trapped in there pretty easily. But we can usually guess what you had for breakfast. So if you don't want us to call you out on what you had for breakfast, make sure you're brushing, flossing, keeping everything clean. Hope this video is helpful. Feel free to leave any comments or questions in the comments, and we will get back to you. Thank you so much for watching today. Our next video is going to be how a tongue ring can impact your teeth. So if you're interested in that subject, please click on the link below. And remember, smiles change lives, so keep smiling.